Greetings, ladies and gentlemen. I offer you the next installment in my video series on libertarian life extension reforms. The third proposed reform is abolishing medical patent monopolies. Medical patents, in essence, legal grants of monopoly for limited periods of time, greatly inflate the cost of drugs and other treatments. Especially in today's world of rapidly advancing biotechnology, a patent term of 20 years essentially means that no party, other than the patent holder or someone paying royalties to the patent holder, may innovate upon the patented medicine for a generation, all while the technological potential for such innovation becomes glaringly obvious. As much innovation consists of incremental improvements on what already exists, the lack of an ability to create derivative drugs and treatments that tweak current approaches implies that the entire medical field is for some time stuck at the first stages of a treatment's evolution, with all the expense and unreliability this entails. More appallingly, many pharmaceutical companies today attempt to repatent drugs that have already entered the public domain, simply because the drugs have been discovered to have effects on a disease different from the one for which they were originally patented. The result of this is that the price of the repatented drug often spikes by orders of magnitude compared to the price level during the period the drug was subject to competition. Only a vibrant and competitive market where numerous medical providers can experiment with how to improve particular treatments or create new ones can allow for the rate of progress needed for the people alive today to benefit from radical life extension. Some may challenge this recommendation with the argument that the monopoly revenues from medical patents are necessary to recoup the sometimes enormous costs that pharmaceutical companies incur in researching and testing the drug and obtaining approval from regulatory agencies such as the FDA. But if the absolute requirement of FDA approval is removed, as I recommend, then these costs will plummet dramatically, and drug developers will be able to realize revenues much more quickly than in the status quo. Furthermore, the original developer of an innovation will still always benefit from a first-mover advantage, as it takes time for competitors to catch on. If the original developer can maintain high-quality service and demonstrate the ability to sell a safe product, then the brand name advantage alone can secure a consistent revenue stream without the need for a patent monopoly. The fourth proposed reform is abolishing software patent monopolies. With the rapid growth of computing power and the internet, much more medical research is becoming dependent on computation. In some fields, such as genome sequencing, the price per computation is declining at a rate even far exceeding that of Moore's law. At the same time, ordinary individuals have an unprecedented opportunity to participate in medical research by donating their computer time to distributed computing projects. Software, however, remains artificially scarce because of patent monopolies that have increasingly been utilized by established companies to crush innovation. Witness the massively expensive and wasteful patent wars over smartphone and tablet technology. Because most software is not cost prohibitive even today, the most pernicious effect of software patents is not on price, but on the existence of innovation per se. Because there exist tens of thousands of software patents, many held defensively and not actually utilized to market anything, any inventor of a program that assists in medical, biotechnological, or nanotechnological computations must proceed with extreme caution, lest he run afoul of some obscure patent that is held for the specific purpose of suing people like him out of existence once his product is made known. The predatory nature of the patent litigation system serves to deter many potential innovators from even trying, resulting in numerous foregone discoveries that could further accelerate the rate at which computation could facilitate medical progress. Ideally, all software patents and all patents generally should be abolished, and free market competition should be allowed to reign. But even under a patent system, massive incremental improvements could be made. First, non-commercial uses of a patent should be rendered immune to liability. This would open up a lot of ground for non-profit medical research using distributed computing. Second, for commercial uses of patents, a system of legislatively fixed maximum royalties could emerge, where the patent holder would be obligated to allow a competitor to use a particular patented product, provided that a certain price is paid to the patent holder, and litigation would be permanently barred. This approach would continue to give a revenue stream to patent holders while ensuring that the existence of a patent does not prevent a product from coming to market or result in highly uncertain and variable litigation costs.